Hey guys, welcome back to the channel. This is Medical Minis and we are continuing our series of videos on the ECG. So in our previous videos, we've discussed how an ECG works, the leads, and also the basic ECG trace. So if you've missed any of those videos, make sure to watch those in order before you watch this so you get a better understanding of the content. So in today's video, we will be moving on to the final part of the ECG course, and that is putting our knowledge to the test. And that is through the systematic approach, as you can see on the screen now. So on the screen you can see the systematic approach, and we will be going through this over the next few videos. However, with any systematic approach, you are free to have a particular order you prefer, such as the one here. This is the one I currently use and I feel comfortable with. However, saying this, you need to still have the main elements within your systematic approach. However, you're free to choose whichever order you prefer. So let's look through the systematic approach I currently use. So firstly, documentation. So understanding, is the ECG in front of you correct for the particular patient you're looking at? Second, elephant in the room. So this basically means, is there something on the ECG that's jumping out at you? Thirdly, is the rhythm sinus, and we will look at what sinus means. Rate rhythm axis, okay, and finally the waveform segments and intervals. And when we do talk about the waveform segments and intervals, what are the main high yield pathologies that you may come across? So as you can see here with documentation, these are the elements you need to be able to check off whenever you have an ECG in front of you. So firstly, the name. Make sure the name on the ECG is correct for your particular patient. Next, the date of birth. Next, the time of recording. This is important as you can have an archive of ECGs, and this is important for a patient that you're trying to see if there's any deterioration over time or any changes in an ECG over time. And by looking at the time of recording, this can be very valuable. And then finally, looking at the following things. So firstly, are the leads labeled? Are they in the correct position? Sometimes it's very easy to mistake the placement of a lead, and there are some signs you can identify in an ECG to be able to know, did I put something in the wrong place? And we will look at one example in the next slide. Okay, the speed. Now, the ECG is generally set at a speed of 25 millimeters per second. That's not to say it can be set at other speeds. However, this particular speed is the universal standardized speed. Calibration. So, is the ECG calibrated? How do you know that? Well, you look at the start of the ECG and you see this tall 10 millimeter rectangular structure, and by seeing this, you know that the ECG is calibrated, it's turned on. And then finally, quality. So what do we mean by quality? Well, when you look at an ECG, you may have seen some ECGs and they don't really look particularly clean, meaning the waves kind of look very, very squiggly. Even the baseline looks very, very squiggly. And for example, you may have seen something like this, okay, or something like this. All right. Now, firstly, let's just talk about quality. So how can we get good quality? Well, firstly, the placement of your electrodes. Sometimes you might have a patient who is, sometimes a bit sweaty or a bit hairy, and this can sort of interfere with the contact of the lead to the electrode, and the electrode or lead may move, and so this can cause sort of a bad quality ECG. And particularly this example we're looking at here, these sort of squiggly lines here, this is when you have a patient that has sort of a high muscle tension, or they may be shaking or a bit nervous, and this is actually what's causing the squiggly sort of lines here. And so you have to try and encourage the patient, if they can, to be still and quiet. And here's an example of where you could have a lead being put in the wrong position. So as you can see here, especially in lead 1, you see that we have a negative QRS complex. Specifically, we have this S wave here, and typically in lead 1, we shouldn't really have and so you see here an example of which. So here's an example of a situation in which you could have a lead being placed in the wrong position. And this is, so here is a example. So here is an example in which you could have a lead being put in the wrong position. And so here, this is the example of lead 1. Now, lead 1 here has been placed in the wrong direction, okay? Instead of the right arm to the left arm, is now going from the left to the right arm, okay? So instead of the right arm going to the left arm, it's now going in the opposite direction. Now, normally in lead 1, we should have positive QRS complex and also a positive T wave. So in this particular situation, we know that something is wrong because we know that the lead 1 should have a positive QRS and a concordant T wave that is positive. Okay, and so this is a way to identify, is there a misplacement of the lead, in this case lead 1. Nope. And the final thing I want to mention for this particular video is the rhythm sinus. And this is a good starting point once you have done your documentation and excluded any serious pathologies. So what is a sinus rhythm? Well, it's a two-part definition. The first, there is a normal P wave, meaning it originates from the SA node. Okay, because you can have P waves that don't originate from the SA node. They can originate from other places in the atrium, okay? However, a normal P wave originates from the SA node, and you can actually distinguish this through the actual morphology of the P wave, because some P waves can be negative, such as in ectopic beats, and then the P wave should be followed by a QRS, meaning that the P wave successfully travels towards the AV node to then go down the subsequent bundle of His and your bundle branches to then your Purkinje fibers to then contract your ventricles, which is illustrated by your QRS. Okay, so here is an example of an ECG, and you may be wondering, okay, what are the best leads to find a P wave? Well, there's two. There's lead 2 and lead V1. They are the two best leads to look for any potential P waves. Okay, now let's start off with lead 2. Why is that the case? Well, if you know from our previous videos when we've talked about leads, lead 2 goes from your right arm to your left leg, and it follows this particular direction. As we know, it is orientated inferiorly. Okay, and so what do we know? The SA node, when it stimulates the atria, when it undergoes atrial depolarization, the net vector goes where? Well, it goes in this particular direction, and as we can see, it's highly parallel towards lead 2. Okay, and as we know, when an impulse goes in the same direction as its corresponding lead, it's seen as a positive deflection, and vice versa. If an impulse travels in the opposite direction to its corresponding lead, it is a negative deflection. And so that's why lead 2 is very good at identifying any potential P waves. So in this diagram, we can see that there's a P wave here, there's a P wave here, and over here. And how about V1? Well, V1 is a little bit different, as it's not really to do with the sort of trajectory of the lead, but however, it's due to its placement on the body. And if you know V1, it is actually located in the right intercostal space, in your fourth right intercostal space on the right sternal margin. Because of its orientation, the SA node is located in the right atrium. And if I was to draw a sternum like this, the V1 placement would be somewhere nearby the SA node, and this is why V1 has a And so why is it good to find out is the rhythm sinus? Well, like I said, it's good so that you could exclude any other rhythms. So if it's not sinus, what does it mean it isn't? Well, it's not atrial fibrillation or flutter because we have P waves, and it's not VTAC or VFib or SVT because we have P waves. Okay, and as you can see, we've ruled out quite a few conditions and quite a few nasty conditions there as well. And so, guys, I'm going to leave it here, and in the next video, we will continue the systematic approach. And so in today's video, we have discussed documentation, is there an elephant in the room, and the importance of sinus and how best to find is the rhythm sinus. Okay, so guys, if you have enjoyed, please leave a like and subscribe, and I will see you on the next video.